Welcome to the BeWell Network program. My name is Dr. Ted Bender. I'm a clinical psychologist and the CEO of the BeWell Network. If you or a loved one is struggling, please visit BeWellRecovery.com. Our number is 888-317-8395. My goal, as always, in this program is to educate people and to help as many people as I can understand that they are not alone. There is help for the many life obstacles that we endure. Today, I am honored to have Emmy award-winning television host and veteran Montel Williams to the show to discuss veteran care. Montel, millions know you as a TV host of the long-running daytime talk show, The Montel Williams Show, which ran for nearly 20 years in syndication from 1991 to 2009. You are currently the host of the amazing program Military Makeover, and you're a big advocate and supporter for veteran support because you yourself are a Navy veteran. If I recall correctly, though, you were originally a Marine. Is that accurate?
I was in the Marine Corps and the Navy. I enlisted in the Marine Corps after I graduated from high school, and then transitioned from there through the Naval Academy, got a commission, and became a naval officer.
Very, very good. Thank you so much for being on the show, and again, thank you for your service. I recently saw an episode of Free Thinking where you were talking about the COVID pandemic, but specifically the mental health impact of that, which is really kind of raging on underneath all of the COVID information and the medical issues. But the mental health impact is vast, and I think it'll be some time before we really understand the impact that it is having. You also mentioned that the impact of mental health is not being talked about nearly enough, and I completely agree with you. The rates of suicide, newly diagnosed mental health conditions, depression, and anxiety have all skyrocketed. This is also very true for the military population, active duty veterans of the armed forces, with post-traumatic stress disorder on the rise. Can you talk a little bit about that?
Yeah, I think you just encapsulated a platform that I have been on now for years, and it's really very, very interesting. Just got off the phone a little while ago, texting back and forth with Dr. Sanjay Gupta, and Dr. Gupta and I, and people know him of CNN fame, but we've been talking about this openly for close to 2 years now, that as the nation focused in on, well, let's back up even before that, before we started focusing in on what we call this current pandemic, if you remember, the buzz pandemic word before that was a pandemic of opioid abuse.
Yep.
And why? Because we're living in a country that won't face its reality, that mental health is the, I think, number one healthcare crisis facing America today. Not just for our veterans. When people think about PTSD, the initial thought is, oh my goodness, a soldier coming home from war and suffering the ravages of the memories that he's had that were built in because of what he saw. But we don't even stop to think about the fact that there are some of them who don't even recognize that silent symptom is going on. They may not even recognize it for 3 or 4 years. It's the same thing that's going to happen now that we have lived through and are still currently living through a pandemic. I saw a poll recently that stated that close to 40 to 45% of those who were hospitalized for more than 2 days because of COVID are now suffering from PTSD.
Yep.
And if we think about the individual who was in those hospital rooms, isolated, wrapped in plastic, people coming into the room looking like space creatures, and not being able to touch them, not being able to interact with their family and their friends and their loved ones, let's do a little numbers game here. 900,000 deaths represent 900,000 families, and let's say that we don't even give credit to make it 4 people for family. Let's just say 3 people for family. It's 2.7 million people affected, living with the memory of the death of a loved one. Mm-hmm. Some of them are traumatically affected because they went to the hospital, got yelled at, got screamed at, got pushed away from the door, couldn't touch their loved one, watch their loved one suffer and die. That's just the tip of the iceberg. By the time we stop and blink, we are living in a society right now that is in a mental health crisis.
Yes.
And unfortunately, those in power don't emphasize it as much as they should, discuss it as much as they should. But the impact on our healthcare system over the course of the next 10 years is going to be, I think, catastrophic. And not just catastrophic. I'm not trying to be the doomsday bellwether here. However, look at what's going on right now. We are living in a society where all of our news outlets can't wait to give you the most dire, depressing story that they can possibly give you around a war that could, in a blink of an eye, become a third world war. But I was just so profoundly affected by the images that our media has the nerve to put into my living room, and the way they have the nerve to talk about something that's costing lives. That's what's going on right now in Ukraine. And I lost sleep over that last night. And I'm just one. But I will bet you that in this country, there's probably a good 10, 15, 20% of our nation losing sleep right now because they are family members in a distant way with somebody in the military who might be deployed. And oh my God, I don't know what's going to happen. And, I have tools that I use to calm myself and try to navigate the space. I'm going to do a lot of meditation tonight so that I don't lose sleep again. But I put conscious effort into trying to maintain my psychological stability. Not everyone in this country does that. Not everyone in this country will even admit to having a problem. So, yeah.
Or even has the skill set to do it, or has learned the skill set, or has access to learn those skills.
Correct. And, and one of the things you said at the very top of this, your BeWell network, you're here to give people the tools that they need to navigate this space about mental health. And I wish more people would take the time to recognize that as much as we would love to just think, oh, woe is me, there's nothing going to fix my plight, the answers are there. There are some answers that have been here for years and years. It's incumbent upon any of us. I suffer from, a chronic illness, and I also suffer from having had a very devastating medical, emergency a few years ago that I was asked today in an interview, well, what kind of advice would you give people? I said, our responsibility as a patient to make sure that when we walk in to see you, we walk in to see you as educated as we possibly can be on the issue that we want to talk to you about. If I come to see you because I'm feeling depressed and I have a mental health issue, I should look up and study. It's incumbent upon me to find the materials and understand. I want to explain it to the doctor. So what are the words that I should use to explain it to him best? It's my responsibility. I am my best advocate. And for me to learn as much as I can so that I can come in and have an educated conversation with an educated person who now understands all the literature that I couldn't even understand when I tried to read it, at least we'll have a more useful, valuable conversation. And that works for whether you have cancer, MS, Parkinson's, I don't care what the illness is. It's incumbent upon the person who is the sufferer to study, arm themselves with the tools they need to get the answers that they need to help them.
Yeah, and on our side, it's just as incumbent upon me as a mental health professional to be delivering the most scientifically supported, up-to-date treatments in a way that they were designed to be treated. I often help people understand this model by going to a medical model like you mentioned. Whether it's diabetes or cancer, there are frontline treatments for these disorders, and it's my job to continue that education and deliver it in the way that it was intended to get the best possible results. One thing that BeWell is that's really important to us and to me personally is veteran care. And I know you're a big proponent of veteran care. I was exposed to treating veterans when I was on my residency in Rhode Island, and I started by treating the post-traumatic stress. That's what we were doing almost all the time. And then very quickly I realized that many of them were suffering from substance use disorders as well, and we started treating that, and that's kind of what led me into that field. What do you feel like is one of the more lacking areas in veteran care with your experience, and what do you think is needed to help veterans, not only to relieve PTSD and substance use, but in general? Where are we failing as a society with our vets?
Well, first thing is, I think the majority of people in this country don't stop for a second and ponder the fact that less than 1% of this population puts a uniform on their back to put their hand in the air to say, I do support and defend the Constitution of the United States against all enemies, foreign and domestic. we live under the flag of freedom because they have bore the burden of going out and fighting for our freedom. And it's something that has to be more consciously thought about, and not just in a passing lip service saying of thank you for your service.
Agreed.
So the first thing we got to do is get Americans to understand that, but for the grace of God, it could have been you or your child that put that uniform on, but you didn't do it. You didn't let your child do it.
Mm-hmm.
You made somebody else's child do it. So I think that what we lack the most is a true respect for those who were willing to put their life on the line for us. I really believe that. But secondly, and again, forgive me for saying this because I don't blame you, but unfortunately, there's almost a cottage industry built around PTSD now. There are those who are trying their best to collect. They may not get up in the morning and say, let me go rip off a soldier. But they definitely damn sure know that they don't want to have their grant from XYZ go to somebody else. There's too much money in this game, I think. And I think what has to happen is that, just like you said, you reach out and try your best to go through continuous CMEs, continual medical education, try to expand your knowledge base. We need to have many more doctors like you that are willing to understand that I don't know it all. I'm not God. I need to educate myself every other day and make sure I keep up with the latest and the greatest.
Agreed.
There's been protocols that have been out here. I think that, I had my office send you some information so you can take a look at it. The RTM protocol has been around now for close to 12 years. But I was told once by one of the world's leading neurologists, Montel, transformative medical protocols are normally met with the most vehement and adamant resistance from the medical community. And that's a fact. I've been working on protocols now for 15 years straight now. Multiple different protocols that have now been peer-reviewed, written about, studied, double-blind studied, using the best evidentiary medicine available to prove their efficaciousness, yet they are met with the most adamant and vehement resistance from some people who are just really trying to protect their job rather than take care of those who are ill.
Yeah, you mentioned this new, not new, it's been around for a while, treatment for post-traumatic stress. And my experience in treating PTSD has been with the two existing therapies that are most widely recognized, prolonged exposure and cognitive processing therapy. And I can tell you, from a therapist perspective, it can work. It does work. It's very hard on the therapist and the patient. And there is a lot of dropout because it's a significant amount of exposure to the pain and threat of the traumas that they have lived through. So when I was reading about this newer method for treating PTSD, I was intrigued by it. And you're right, there is a lot of research out about it, and it needs more. It needs more funding for sure, and the funding game is very difficult.
You're right. It's funny, but but when we stop and look at it, it's been used by the state of New York. It's been used by the state of New Mexico. It's been funded by King's College. It's been funded at Walter Reed. It's had protocols done. How many more people have to step up to the plate when you look at the whole totality? It's about 91% efficacious.
Yeah, I'm intrigued.
That's the reason why I got involved.
Yeah.
Because I'm really trying to be the trumpet that blast from the top of the hillside saying, stop for a second, guys, please take a look at this. And there is now funding coming to the table. I've been working recently with a group out of California and a group out of New York that have been working on a protocol that, is very, very controversial, but it's looking at ketamine treatment. And I know ketamine has been used at Walter Reed. Unfortunately, some of the ways that it's been done have not been as efficient as some of the protocols that are now being established in a couple of centers in California. This has to get out.
Actually, the research on ketamine for treatment-resistant depression is actually pretty good. Yeah, for our
Sure.
listeners out there, we're talking about a treatment called reconsolidation of traumatic memories, or RTM. So for those who don't know, I'll tell you from a clinician's perspective, what is intriguing to me specifically is the speed of which it can be done. Because like you said,
10 hours.
yeah, not just veterans, but anyone suffering from severe trauma. I can tell you, spending even one day dealing with the symptoms that they deal with is too much. It's way too much. So we need to get better as a treatment industry, as clinicians, in creating faster treatments that work faster with less dropout, because it's tough to get through a full dosage, so to speak, of PTSD therapy, because it is a lot of exposure to the fear and pain and threat. And it does work and it does help a lot of people. But it's difficult on the therapist, it's difficult on the patient, and we need to do better.
Absolutely. And and again, I'm not knocking. I really don't believe that it's an aspersion against exposure therapy, which runs between 37 and 40% rate. And you're right, because a lot of people drop out of that protocol. A lot of veterans drop out of it and they get angry about it, and it entrenches their PTSD even more. But 35% is good. When we're talking about a protocol that right now is running 90% efficacious, I think that we got to stop. And unfortunately, and fortunately, modeling of transformative medical protocols requires extensive double-blind studies.
Yes.
That's been standard for the last 100 years. But if we had stuck with that standard during COVID, we would not have come up with 5, 6 different variable vaccines.
True.
So there is a time for a protocol. There's a time to say, let's go through these steps. But when the steps become too daunting and are detrimental to helping those who suffer, I say it's time to, let's say, look, if you came to me tomorrow and said, Montel, I got something that's 9 out of 10 times it works. 1 out of those 10, it's not going to work. I'm going to say, homeboy, skip the next 3 clinical trials that you're thinking about doing, jump to A, and let's start treating. So at least the one that we miss, we will catch up. We'll get to them. But the other 10, another 9, let's get them cured.
Yeah, and it is important to do the clinical trials, double-blind procedures like you mentioned, and that does take time, unfortunately, and there is difficulty attaining grants, and grant funding is highly competitive, like any medical trial of medication. But here's a simple fact. We know more today about drug use disorders, post-traumatic stress, suicidality than we ever have. The research and the money out there has been profound, yet suicide rates have increased dramatically over the last 10 years. Overdose death rates are at a staggering number, and veterans and the whole population.
Say that. Something very important, though, Doctor, maybe you could also just amplify this fact. All of a sudden, for the last 2 years, we've been talking about COVID and haven't been talking about opioid abuse.
Yeah.
And opioid addiction and overdose deaths. But the overdose deaths didn't stop 2 years ago.
They got worse.
They are still on the rise right now today. Yep. Yeah, I'm so sorry.
Yeah, and you had the perfect combination, right? If you talk about what would increase suicides and overdose death, isolation and economic downturn. Put those two together with COVID, and you had the perfect petri dish for an explosion of mental health issues. And with trauma too, there's a lot of teens out there that are showing significant PTSD and trauma signs early. Like you mentioned, a lot of them have lost one or both parents. A lot of them got sick, even if they survived. There's a lot of trauma there. Then they were isolated. Schools were shut down. They weren't around their friends and their activities. So they went from these social creatures to living inside their little box. They may have lost a parent. They may have multiple sick parents. And now we're seeing a whole new generation of trauma coming up in young teens and even kids.
Which we'll see the next 5 years. When you say young, let's say for the next 5 years we'll deal with it. There'll be a little lull in the storm. Then 15 years from now, we'll see it again when they hit 40, 45.
Yeah.
So, it's something that I think we really as a society have to stop, put the brakes on, and say we need to address this today and address it with as much funding as we possibly can. Because, just the same way as we almost overwhelmed our medical system when it came to COVID, we are going to overwhelm the medical system in the next 5 years when it comes to just mental health issues.
The early research alone is showing a 30% increase in symptoms of depression and anxiety at large throughout this country. And if you think about it, we as a nation, or as a world really, have suffered and gone through a significant trauma. And then there's various levels of it depending on how much COVID really affected you. And you're right, with trauma, especially in our younger generations, untreated trauma has a tendency to kind of be like a seed that's buried down deep, but over time sprouts and grows throughout and affects all areas of your life. And when they're 18, 19 years old, we're going to see that next boom of mental health problems in this country.
I agree with you 100%, sir. So, back to the question though. So what else could we need to do
Yeah.
for our veterans? I really think that, right now, while the time is there, I don't know if you know who the former Secretary of the VA, Secretary Shulkin, is, but Secretary Shulkin was the Undersecretary of the VA under the Obama administration, and then under the Trump administration became the Secretary of the VA. And he implemented a protocol at Walter Reed and in the Washington, D.C. medical complex, military medical complex area that was looking at specifically more pain than PTSD, but PTSD was a part of the pain issue that a lot of the veterans were facing, and implemented a new and very, very intriguing protocol that's a multidisciplinary protocol that puts together a team. It's a team approach to pain, but that same team approach to PTSD would work as well. So I'm working with Secretary Shulkin right now to try to see if we can, get this utilized not only by our veterans, but also by our civilian population also.
So a multidisciplinary approach, treating the whole person. Yeah.
Yes, sir. You're treating, you have a pain medical, a doctor, you have a pain psychiatrist, psychologist, you have a pain therapist, physical therapist, and a pain coach. All four of them who right now today, it sounds like I'm saying something, that goes on all the time. No, it doesn't. It doesn't go on anywhere in the country. It was happening at Walter Reed for a period of time. It's going to continue at Walter Reed, and it'll kind of expand across the country. But this multidisciplinary approach where all those doctors actually stop and look at a patient, have a conversation about patient A together, put together a working criteria for that patient or a protocol for that patient specifically, and then they check in with that patient on a weekly basis so that each one of them, maybe the pain doctor who is writing the prescriptions doesn't have to check in every day because the pain coach is giving them, some feedback and letting them know what's going on. But once a month, that pain doctor sits in a conversation and says, guys, okay, how is Montel doing? And then the whole team says, well, I got to tell you, we've been working at reducing his pain. And, the side effect is he's sleeping better. The other side effect is that he's psychologically saying that he's doing much better. He's coping much better with the situation. So we're seeing that this is paying off. And, Secretary Shulkin implemented this program at Walter Reed, and they saw, almost like a 40% improvement in pain outcomes for all their patients who were involved. It's about 500,000 of them. So now, do I have to do another, and to get this moved out, we're trying our best to move this across the country, but everybody's calling for it. We need another clinical trial. It's like, I'm going, excuse me, you got 500,000 people. What do you need?
Yeah. It's slow and arduous process, and that's probably part of what we need to fix in order to help improve mental health outcomes. And you mentioned the multidisciplinary approach to pain, which is so smart because working in addiction like I have, I can tell you people with legitimate severe injuries who become addicted to opioids, they tend to do rather poorly in treatment because once treatment's over and the pain isn't addressed, they go right back to the only thing that worked, which is the opioids. And pain is not a unitary construct. It is physical, it's mental, it's behavioral, and all of those things need to be addressed. And that's why, the multidisciplinary approach is an effective way to get at that and other mental health disorders.
And I think when you were talking earlier about PTSD, what I think a lot of people don't understand is that, PTSD isn't just a memory. PTSD isn't just a psychological. PTSD is something that literally we are finding imprints in the brain. We see physical changes in the brain when a person is suffering. And when you cure a person with RTM, we're seeing physical changes back in that brain
Mm-hmm.
again because, it's like pain. Though the initial break, let's say you break your femur, which is, I'm told, is one of the most painful experiences anybody can have in life, more painful than even breaking a hip,
Mm-hmm.
breaking that femur. But the pain of breaking that femur really is a physical pain for probably 2 to 3 days. But we hardwire that pain in the brain. So the brain says, I still hurt, even though physically it's not there. It's up here. It's not psychological. It's not psychosomatic. It's a hardwire. The brain gets caught up in this loop that says, I hurt, I hurt, I hurt, I hurt, I hurt, I hurt, I hurt. We got to stop that cycle. And there are several things that can do it. I mean, I think there's incredible breakthroughs being done in the psilocybin, ketamine world that's showing that you can make a break to get the brain to stop that loop. And then multidisciplinary, why in a multidisciplinary way, then take the person from the fact that that break took place and help them deal so they don't have to come back and do that over and over and over again.
Yeah.
Some exciting research being done on that around the country.
I think so too. I'm actually very excited about some of the frontier research that's being done in all these areas. And again, I don't think there's nearly enough funding for these things, and we're going to suffer as a nation because of that. And we're going to end up spending way more money down the line anyway than if we would just fund the research for these projects more heavily.
I agree with you 100%. You can pay me now, you can pay me later.
Exactly.
And we are going to be paying later.
Just a few minutes left, Montel. I did want to mention your show, Military Makeover. You're helping veterans get back on their feet by remodeling, building their dream homes to be comfortable and safe. And I wondered if you could talk a little bit about your show and what your mission is and your goal there, and how you're helping veterans.
Well, this show has been on the air now for about 7 years.
Yeah.
I was very blessed to be asked to fill in when its original team leader host, who was the actor and former Marine Gunny Army Early, he was the host and had a medical issue of his own and had to step away from the show and was asked, who would you like to see replace you? He said, I think I'm Montel Williams guy. And, fortunately, the Brand Star company that produces the show reached out to me and I jumped at the opportunity. And what is the show? It's called Military Makeover. And like a lot of the makeover building shows that you see on HGTV and all these shows, those channels, we literally do something a little different. We go in and in less than 10 days, we can make over a veteran's house from the ground up.
10 days, wow.
And we're talking about change everything from the floors to the walls to you name it. We pick deserving veterans, and there's a criteria for what makes them deserving. But once they're nominated, we select one, and then what we're doing is trying to turn their house into a forever home.
Yeah.
We're not giving them a handout, but we're giving them a hand up, and we're allowing the community to come in. Because back earlier, I said to you, it's no longer time that we just say thank you for your service. Let's do something about it.
Yeah.
And so we take these veterans who have left parts and pieces in the battlefield here trying to figure out how to regroup their life. In 10 days, we kick them out of their home, we put them in a hotel or send them to their friend's house. And then while they're gone, we got a really unbelievable designer. Her name is Jennifer Bertrand, who interviews the family and incorporates the family's wishes and wants and puts that into this gift of love to kind of create the space that they want to live in. Got another co-host who's Art Edmonds, who then reaches out to the community at large, because our work is done by volunteers. We have people come in and volunteer to swing the hammer. We got people coming in digging the ditches. We got people coming in helping to do the roofing. We have companies that donate whole kitchens and bathrooms and all those things. And all that's put together in 10 days to allow the family come back and do a big reveal. And then we let them in. And it is one of the most rewarding things I've done in life, because, you recognize that this is a family who has thought they were forgotten and now feel remembered.
Yeah.
We're so appreciative of the remembrance.
At the BeWell Network, we really strive in creating supportive clinical treatments for our patients, and we really have a very deep passion for helping veterans. For anyone out there who's struggling, please contact BeWellRecovery.com. Suicide rates continue to spike with veterans because of their trauma, untreated substance use disorders, as well as other difficulties such as lack of job opportunities presented to them when they return from the military. Resources such as military.com, hireveterans.com, and hireheroes.com are available for veterans to help get back on their feet and to help them more greatly utilize the skill sets that they have acquired in their military training.
I was going to say, I do another show which is called Military Makeover Operation Career, where we feature businesses around the country that offer veterans jobs. So you can go up on Lifetime and take a look at that too. So there's militarymakeover.tv, where we actually make over a home. Then there's a second show called Military Makeover Operation Career, where we talk to and feature those companies that are hiring veterans and love to have veterans as part of their company.
That's great. I've always loved hiring veterans myself. And I remember a patient I was treating once said, how am I supposed to go from driving an M1 Abrams tank in Iraq and come back and work in a gas station? You know, the skill sets and the technical skills that they've picked up over there, and then come back and do something that has nothing to do with what they've learned. So thank you for doing that. There are also many excellent treatments out there for addiction and mental health disorders that are available. And to all of our listeners who are listening and who have joined us for today's show, remember that often the toughest step in healing is the first step. To our audience, if you're not watching it already, I encourage you all to watch Montel Williams' program, Military Makeover. It is a great show. Thank you for all that you do, Montel, for our community and veterans. Thank you so much for being here today.
Thank you, Doctor. Thank you so much for what you do, and keep plugging on. Anything I can do to help you, any information you need about the things that we talked about, or I'd love to plug you into some of the protocols that we're working on.
I actually will take you up on that, Montel. Thank you. To our listeners, please like and subscribe to our channel to stay informed. You are not alone. Until next time, I'm Dr. Bender. Be well.